let's talk about what are the mistakes we do when we enter 40s. Yes, this is that eagerly awaited part 2. So what are the mistakes that we do on the skin? So for that, let's first find out what happens to skin when you enter 40s. Like I always say, +5, -5 can also get enough knowledge from this particular video. So what happens is, first thing is of course dry skin, and then you could have acne at this time. You could also end up having pigmentation. So these maybe, and then the skin starts to feel a little more aged and not so plump by the time you just about touch 40. So what are the mistakes we do? One, of course, we see these changes and we run to do something. The first mistake is going and over exfoliating. Yes, is there a term called over exfoliation? It is, because I see a lot of patients, by the time they come to my clinic, they are like stretched, dried, red, shiny skin. And they're like, oh, we just did this beautiful peel elsewhere and it's looking fantastic. I'm like, no, this is not looking fantastic. This is looking fantastic for now, for today. Tomorrow morning, come tomorrow, this is going to become a nightmare for you because it is over exfoliated, over peeled and sensitized right now. That's why it's looking pink, stretched and tight. Anything which looks pink and red, I always keep saying, is going to turn black, is going to get its pigmentation on. So please be careful, don't over exfoliate. So how can you over exfoliate? You could end up using too much of the good thing, which is retin A. We all think, oh, we're aging, we've touched 40, let's start using retin A. Without asking your dermatologist or consulting an expert, you end up using a retin A, and that percentage might be too harsh. That chemical format of retin A might be too harsh for you. Usually, for skin such as ours, which is brown, which is thin, which can get sensitive, we have a lot of sun and pollution all over, I like to mix my retin A with other creams to ease it off. So therefore, your retin A has to be chosen really, really wisely. Otherwise, you will end up over exfoliating your face and sensitizing it. 2, over scrubbing. That's a term which I totally hate. It has to be gentle exfoliation, not harsh scrubbing. So it's important for you to understand, even if it is a home care thing, even if it is a oat dust or whatever powder that you've taken at home, you end up rubbing it too harshly and the powder size is too granular. That is going to cause aberrations on your skin that you don't want. So that again is over exfoliation. Do not do that. The next way you could do it is probably, you end up reading about AHAs and BHAs and you end up buying creams which has AHA and BHA, or toner also with a BHA, a face wash also with a BHA. So same ingredient, maybe it's a good ingredient, but in all through your skincare regime might lead to over exfoliation and over sensitization of your skin. So you need to also be aware of that. Then of course at your doctor's office, you go and we end up saying, let's do peels. That's actually one of the best ways to rejuvenate your skin. It will address everything. Yes, there are hydrating peels. It will address your dry skin, it will address your pigmentation. It will also address your aging skin and collagen regeneration. But you need to be very careful what peel you choose. You have to ask smart questions to your doctor, like what's the pH, how many layers, how long are we going to keep, what are the acids in it, so you don't end up doing it too often or too aggressive a peel, which might lead to over exfoliation. So these are things that you need to be really, really careful and not do the mistake of over exfoliation. And the next skincare mistake you could do is trying to just put yourself your own skincare regime. Like I said, in that, the biggest mistake can happen is where you may not even know firstly what's the right ingredient for you. If you do know the right ingredient, you can end up overdoing the right ingredient. Even the good thing in a larger quantity or an excess can become a bad thing. So you need to be very careful. And firstly, get yourself a skincare regime. Not having a skincare regime is the biggest mistake you can make at your 40s. Even if it is a simple thing like the right face wash, the right sunscreen, and a right nourishing moisturizer. Even if it's just these 3, that's something that you need to have. So not having a skincare regime is the next mistake you may end up doing. And the last one, if I have to discuss in this video, would be supplementation. A lot of us are into supplementation today. That is in fact the topic of the hour. But please do not do it on your own. A lot of supplementation may not even be made by legitimate companies and backed by legitimate scientists. It's important for you to know. Please understand someone who's prescribing it also needs to be qualified enough to prescribe it for you. So it's important for you to see the source and who is prescribing it for you. As a doctor, when patients come to us, we also end up doing a lot of chit-chatting, which we call it as history taking. So we figure out what's happening with you just by clinical analysis. We look at your skin, we look at your hair, we do analyze and say, oh, maybe this is deficient, this is not. If we really need, we may also put you on a few blood tests to figure out what is it that you actually need, and then give you the right supplementation. That is more important. Or you would rely on certain, like I said, experts and websites where they would give you a scientific backing as to why they are prescribing what onto you. So this is important for you to choose your supplement really right, and do start taking supplements. This is a time when there is a little shift in your metabolism, a little shift in your hormones, a little shift in your probably lifestyle and energies, and to just pep it at the right time, you need the right supplementation. And then if you do have adult acne, do not pick it. All of us tell our teenage children not to pick, but you'll be surprised the amount of adults I get with acne that is being picked. So do not do that. A shift of hormones just around 40-ish might lead to adult acne. Please meet your doctor. The doctor will analyze and put you onto the right medication. This needs treatment. Do not ignore it. It's not like a teenage acne which might just even go away. This really needs some care. So yes, so meet your expert. Take care. Don't make mistakes at 40.